Trauma. When we hear that word, we usually think of a scene from a hospital drama, or veterans and PTSD might come to mind. But those examples are only the tip of the trauma iceberg. Trauma is defined as an emotional response to abnormal circumstances or terrible events. In Delaware, trauma impacts the lives of over half of the state's population. Untreated trauma is a public health issue with far-reaching branches into our communities. The first step to tackling a problem of this magnitude is awareness.
So the value of trauma awareness is that everyone in communities throughout Delaware is aware of how trauma impacts our brain, our bodies, our emotions, and our responses to things that occur to us.
You know, it took me quite some time to really understand the prevalence, the impact of trauma. And it's been a symbolic journey because I think sometimes it requires a diverse approach. It requires a full court press, if you will, in terms of ongoing messaging and information that sets the tone and foundation for humans to change or to move their particular perspective from left to right or A to B. So it happened to me as well. I think awareness is the critical aspect of behavioral change with anything. In this concept of trauma and understanding the importance and the role of trauma, mental health and trauma has an incredible stigma to it. So when people typically hear those words, it comes with a negative tone. So the awareness piece has to be a critical tone in terms of inspiring change.
Untreated trauma changes how a person copes and adapts to their world. Long-term effects can range from mild to severe and manifest both physically and mentally. These responses to untreated trauma may include symptoms like headaches, fatigue, digestive complications, while the emotional symptoms range from anxiety, sleep disorders, and depression to substance abuse and emotional dysregulation. It results in poor socioeconomic and health outcomes for individuals that the CDC estimates cost hundreds of billions annually.
Trauma and the experience of trauma, the reactions people have to experiencing trauma affects everybody. Even if you yourself haven't experienced a traumatic episode, you are with people who have. You know people who have. You work side by side with people who have experienced trauma. The question that we always have is how has that person adapted to the experience of trauma and the stress it's created? Sometimes those reactions end up creating more problems. Sometimes we say hurt people hurt people.
So for the ordinary person driving through a community and seeing high rates of obesity among children or among adults may think those people just eat poorly. Obesity, which is a common chronic disorder in a lot of impoverished communities, people think those people are just lazy or they don't have the knowledge of how to eat properly.
Individuals and organizations that are equipped with the tools to help those who have suffered trauma can work to help those people build the resilience they need to move forward and to live the life they were meant to live.
I think what we have to acknowledge about trauma awareness is that it is a basic standard of care. This is not an add-on. This is not an extra thing. This is a 21st century basic standard of care. Trauma-informed care is informed care. This is like knowing somebody's blood type. This is like knowing if somebody has diabetes. This is that kind of level of care. You cannot serve people well, whether they are children in school or clients at a state service center or your employees in a private business. You cannot serve people well if you do not have a significant level of being trauma informed.
Governor John Carney passed Executive Order 24, which declared Delaware a trauma-informed state. The order called for state employee training, data collection on adverse childhood experiences, trauma-specific language in state service contracts, a community-wide self-care toolkit, a trauma awareness month, and more.
Well, policy is essential, regardless of who is setting it. So you could be talking about legislation, you could be talking about court decisions, you could be talking about executive actions. All of these set an expectation and a context that other people then respond to. So for example, Governor Carney's Executive Order number 24 sets an expectation that state employees will become aware of the impact of trauma and will pay attention to the experience and the history of trauma and the people they serve.
Trauma Matters Delaware has been started out as a very informal network of people interested in this subject and grew to have an email list of more than 1,000 people. This is an all-volunteer, very informal organization that really was, I think a lot of the founding ideas for of trauma-informed state started with Trauma Matters Delaware and also with the Trauma-Informed Schools Network. So there was an informal network and some things operating independently of each other long before John Carney, our beloved governor, and I came on the scene. I think Executive Order 24, which set the goal of Delaware being a trauma-informed state, catalyzed that informal movement into a formal movement. And that's when social contract was brought in to help the Family Services Cabinet Council organize these things from the state, from the government perspective, and also to help the private sector and the nonprofit sector to bring everybody together, sort of rowing in the same direction on this initiative. I think the executive order was crucial. I think that government needs to lead with itself and not just ask other people to do things. And I think also the structure of the Family Services Cabinet Council was crucial. Our First Chance initiative, which is the first spouse initiative in Delaware, that's basically designed as a parallel to the Family Services Cabinet Council. The whole idea of that is to get people out of silos and get everybody who deals with children and families talking to each other, knowing what each other's doing, sharing objectives, and First Chance is modeled on that. So I think Trauma Matters Delaware, that informal network, the Trauma-Informed Schools work, which had, again, a national partner, all that coming together with the Family Services Cabinet Council and the executive order, and social contract coming in as an agent kind of structure. All that together got us going.
In partnership with Social Contract, Trauma Matters Delaware serves as a hub in advancing the collective effort to prevent and heal trauma. Through coordination, education, and advocacy with government, public, private, and other nonprofit organizations, we are working towards a Delaware where all people can feel safe, grow beyond adversity, and thrive.